My name is Anastasia and I'm from Occupational Therapy. Today I want to talk to you about 5 hip precautions now that your family member is returning home, and some safety awareness and techniques to help prevent hip dislocation, pain, and just optimize overall healing process and performance when they get home. So the first thing is you don't want to bend your trunk more than 90 degrees. So we're not bending over to pick things up. As provided from the hospital, you received a hip kit. That hip kit contains a leg lifter, a reacher, some stretchy shoelaces, a sock aid. Use those things so that way you do not bend your trunk forward more than 90 degrees. The next one is you never want to get your hip higher than your knee, higher than your hip. So with that being said, if you have any low surfaces to sit on, like a futon, a comfy, low designer chair, we suggest that your family member not sit in it, or put some pillows and blankets just to make sure that knee never gets higher than that hip. The third is you never want to bring your operated leg past midline of the body. So we never want to, if you can see me back up, we never want to bring our leg over like this. And we do not want you to rotate your operative leg. So turning it inwards, and you can't really see my feet, but if you were to go pigeon-toed, that would kind of be that motion. Don't turn that operative leg inwards. And then you don't want to put more weight on the operative leg than what the surgeon instructed. If the weight bearing is as tolerated, then just as much as she can tolerate. But if it is partial weight bearing or non-weight bearing, which probably is not the case, but just make sure we're following all directions from the surgeon. So the other tips that I have for you is being able to, when you come home, you want to remove all of the rugs, anything your family member can trip on. For example, in my own home, this would probably be something that we wouldn't want, because I have a gate to keep my dog from the inside of my living room. This gate is really hard to step over, and you could possibly trip and fall. Falling is a no-no. We do not want to fall at all upon returning home. We want to prevent that as most possible. We also don't want to trip on any rugs, and we want to make sure that all the seats are high enough that we don't break those hip precautions. Another thing is in the kitchen, and I can't, let's see. In the kitchen, you always want to place your items where you don't have to bend down to break those hip precautions. So if everything's on the counter space, then you don't really have to bend down to do anything. But if you have something in the lower cabinets per se, that's something we want to make sure that everything is out and where we need it. So that way, if our family member does want to try to make a small sandwich or a snack for lunch, she's not bending down to try to get into those cabinets. So my last thing I wanted to show you is how to get up from a surface like a couch. So let me move this here. Can you see me? So as you can see, my hips are lower than my hip is lower than my knee. So this is an okay surface to get up from. But since your family member needs a little bit of help to get up off of surfaces, we want to make sure she knows how to get up from, let's say, the couch, and with your guys' assistance if needed. So normally we want to bend forward to stand up, but that breaks our bending our trunk past 90 degrees. So we want to kick that operative leg out just to prevent it from even wanting to go past 90 degrees. And if you can, I have an armrest here, use your upper body strength to help get up. So getting up like this prevents me from bending past 90 because I didn't lean forward to get up. I pushed up and then it was up. And also using my upper body strength to help compensate, because coming out of surgery and having pain in that hip possibly, you really just want to use what other strength we can to help as the healing process goes on. All right. Well, I hope that's helpful, and thank you. And if you have any questions, just feel free to email me or give me a call. Have a good day.